You're live. Hello, everyone. Good evening, and welcome to 5 o'clock. This is another episode, and this month we will be talking about breast health. Thank you for joining. So today, like I said, we'll be talking about breast health, and there is no other better time to talk about this particular topic than this time. October has been declared National Breast Cancer Awareness Month, and we've decided to talk about this crucial issue at this time. And there is no better person to have on this seat talking to us about breast health than our guest for today. So that takes me to introduction of our guest. Our guest is Dr. Feyisayo Daji. Dr. Daji is a medical doctor, a consultant radiologist. She works with National Hospital Abuja in Nigeria. She had worked with so many organizations concerning breast health and breast cancer awareness. She is passionate about this, and she wants to share some of the wealth of knowledge with us. So, Dr. Feyisayo, you're welcome.
Thank you very much, Seun, for having me. It's good to see you after a long time.
Yes, it's been a long time. It's been over 25 years now, I believe, close to 30 years. Feyi is my very good friend. We've worked close together, and she is a very, very compassionate person when it comes to people's health and people's well-being. And I believe today you will be blessed, even as she shares some of her wealth of knowledge with us. Thank you for coming once again. I know this time is a very, very important and very busy time for you, Feyi, because I know you're very involved in moving from one place to the other, educating women and doing awareness. I saw some pictures of you on Facebook doing work and all that. And for you to be able to say yes to our invitation, that shows how passionate you are about this topic. And I want to say thank you for that. It's good to have you.
You're always welcome. Thank you so much for having me.
So why this topic at this time? We all know that women are very, very private. And then there are some topics that we don't really want to talk about. There are some issues that it's kind of like no-go area for us. And one of it is breast. We don't want anyone to talk about our breast. We think it is very, very private. But why do you think we should be talking about our breast health, and why this time?
Well, it's true that our breast is private, but as you know, it's still part of the body and can be affected by diseases. It is not spared from diseases. So we still need to talk about our breast and our breast health. And the earlier we detect the disease that affects the breast, and the earlier we start treatment, the better the outcome. So that is why it is needed. Talking about our breast health is very important, like any other part of the body, to prevent worse outcomes resulting as a result of any disease, any breast disease. So we need to constantly talk about breast health.
That's very good. Thank you very much. Women are so private, just like she said. We don't want to talk about it. We don't even want to talk to our parents about it. We don't talk to our friends about it. We don't talk to our doctors about it. It is my private issue. I don't want you in my life. But there's a lot of movements going on right now. And one of it is the declaration of the National October month for being Breast Cancer Awareness Month. This is to break the norm of silence, the norm of silence when it comes to our health issue, the norm of silence when it comes something that can impact our lives. And this that we're doing today through 5 o'clock is to partake of breaking this norm of silence around breast cancer and allowing people a voice to ask their questions, and then have somebody that is very knowledgeable answer some of our questions. So thank you, and you're welcome to this. So, Feyi, I know a lot of people talk about breast cancers. You know, it's rare to have one person that have not heard about breast cancer. However, I believe there are some other issues that affect breast apart from breast cancer. Do you want to educate us on this? What are the other issues that women face with their breast apart from breast cancer?
Yeah, there are a lot of breast diseases apart from breast cancer. Breast cancer is the malignant form of a breast disease. We have the benign breast diseases, which are quite a number. And topping the list of these benign breast diseases, we have the fibroadenoma, which is a lump that is found in the breast, but is benign. It doesn't have any, is not malignant, it's not cancer. And when you are talking of breast diseases, it actually accounts for most of the lesion we find in the breast. And apart from that, other things that can affect the breast, especially during lactation, during breastfeeding, you can have mastitis from things like having cracked nipples, from there infection can set in. You can end up having a breast abscess that is very painful, that you might even need to have it drained. Then from things like even peri-lactation, so the galactoseals. We have the galactoseals. We have things like hematoma. It can also affect the breast. We have what we call the fibrocystic disease of the breast. And it can also be just ordinary cyst, a solitary cyst, which is fluid containing mass that can be in the breast. The list is inexhaustive of the things that can happen to the breast.
Thank you so much. So Feyi told us that there are so many other issues that can affect our breast aside breast cancer. And she mentioned mastitis. It just reminded me of when I had my first child. And you know, as a first-time mom, there are so many things you don't know. Even though you know you might be a medical doctor, but if you're a first-time mom, you're a first-time mom. So I had this issue with mastitis, and I remember it was really, really very painful. So if you have this knowledge that there are so many things that can affect your breast, that is actually not breast cancer, I think that is wealth, because that will help you seek help when you know that there is something unusual going on with your breast. And then the earlier, like she said, the earlier you seek help, the better for your breast health. So thank you for that. My next question is, I know you talked about women during lactation, when we're breastfeeding and all that. And we want to know, does breast health affect men as well? Or is it just women?
No, breast health, as long as men too have breasts, though rudimentary, not like the woman's zone, they still have issues when it comes to their breast. The general one is when the breast is developed like that of a woman in a condition referred to as gynecomastia, which can be due to a lot of reasons. It might be due to drugs, it might be due to some form of substance abuse, marijuana. It might be due to, it might just be hereditary, it might be familiar. And then some men might not really like it, having to have some feminine look. And another thing is we can have breast cancer too in men. It's been found that at least 1% of breast cancer occur in men, less than 1% really occur in men. And that the average lifetime risk of a man developing breast cancer is about 1 in 1,000. So it's also very, very important in men. And another thing for men, when they develop breast cancer, you know, the men they don't have the breast mass like the woman's zone. So it's always when they have breast cancer, it spreads and eats into their muscles, into the pectoralis muscle, because that's about all they have because they don't have the breast mass. And so their own spread might be faster. So we need to talk about men breast too, in breast health too in men.
That's very important. Thank you so much. So this is to say that this topic is not only for women, because I am sure that so many people seeing the poster of this presentation will be like, oh, this is not for me, this is for my wife. Actually, it is actually for you. We all have to be aware that breast issues can also occur in men. And like she said, there is less than 1%, even though it's less in men, but it happens. And when it happens real bad because, like Dr. Feyi said, because you don't have the breast mass. When you have the breast cancer, it eats up into your muscles, and that affects you a whole lot. So it is very important for men also to take care of their breast and to seek help when they discover something unusual with their breast. So my next question is the size of my breast. So someone asks, does the size of my breast affect my risk of getting breast cancer? Does it depend on, will you say that people that have big breasts have breast cancer more, or people that have small breasts have breast cancer more? Is there a correlation?
Well, there's no scientific evidence that there's a correlation between breast size and breast cancer. But what I can tell you is that if someone has a bigger bust, there's a possibility that detecting a lump by examining yourself might be a little bit difficult than smaller breast masses, than smaller breasts. So if you are a little bit busty, you might not be able to detect the lump on time in a big breast than you would do if the breast is smaller.
That's good to know. So if you have big bust, might be very difficult to fill the lumps because of the mass of the breast. So that's why it's very important to seek help. If you're used to doing usual annual regular doctor's visit, that will help to be able to detect that on time if it's very difficult for you to detect by yourself. Thank you very much. So how about the size of my bra? Some people say that wearing tight bra or loose bra can affect the risk of having breast cancer. What do you have to say?
Well, for bras, basically what people have said is the underwire bras, that the underwire bras can compress the lower part of the breast, and then it will prevent lymphatic drainage, and it will at least prevent or block the lymphatic drainage and can now predispose to breast cancer. As I said, there's still no scientific evidence that wearing underwire bras or not wearing bra at all have an increased people that have increased risk of getting breast cancer.
Thank you. So, you know, women, we are so passionate about our looks, how we look and all that. And our breast is a big aspect of that. It shows the feminism in us. It gives us the beauty that God gave us. So the next question is, what do you have to say about people trying to improve their look by doing breast augmentation, or people trying to improve their look or feel more comfortable with themselves by doing breast reduction?
Yeah, by and large, breast augmentation, it can actually be done just because for cosmetic reasons you want to increase the size of your bust, or in women that already had breast cancer and had mastectomy, they want to do a breast reconstruction. So in it, the complication that follows any normal surgery will follow breast augmentation surgeries. But basically for implants, because you have different composition of implants, you have the one that is saline, you have the one that is silicone, depending on the type of implants you have to have. There are some older implants that have been implicated in a type of lymphoma, the anaplastic large cell lymphoma. But those kind of implants are even no longer in use. But you have people that have had those implants, that those implants are still in them. And so you still need to know about it and to know in case such problem arises from their breast. Other things that can result as a result of having breast implants is things that they call the breast implant illness. And as I said, even in that, it's just a normal illness. It can be seen in any other condition, thyroid, condition with thyroid, any other condition. You can still have the general feeling of unwell that you have with any procedure. Another thing you can have with that, the implant can rupture, the implant can be deflated, and then other things that can occur when you have regular surgery or regular implants in any part of the body, it can be infected. And another thing, the basic thing about implant now is implants that tend to cover or mask very sinister lesion. It's possible depending on where it is located. And if you are doing imaging and you are not imaged properly, you might not be able to detect those very small lesions that might be sinister, that might even be a cancer. You might not be able to detect it. But once you have the proper imaging done, the type that you're supposed to done for people that have breast implants, you can discover such lesion. But ideally, it could mask lesion. Those are the drawbacks of having breast implants. And for reduction, well, for people that have reduction, people that have big butts always complains of either neck pain or back pain. So maybe reducing it will reduce those symptoms of back pain and neck pain, really. Or some people are not just comfortable with the size of the breast. It affects them and they want to have it reduced. And as I said, it's still a form of surgery, and anything that's any complication that could arise with any form of surgery will arise from breast reduction too. And the need of going back to correct some things can still arise if you have a breast reduction. By and large, it's just individual preferences and choice.
Thank you. I like that you said it's individual preferences and choice. So I don't think there's anything bad in wanting to look good, to look better, to feel more comfortable, and to alleviate some symptoms if your breast are causing you some symptoms, like she said, back pain and neck pain. But we should weigh the risk. You should talk about it to your doctor when you go to visit your doctor. Ask your doctor, what are your risks? Ask your doctor a lot of questions and be very comfortable that you're ready to go for this. And she also mentioned that sometimes if you have an implant, it can mask lesion if you have a lesion when you go for imaging. So when you're going for imaging, it might be very helpful to let whoever is doing that mammogram or imaging on you know that you have breast implants, so that the person will be very, very, will be able to do the implant properly to be able to discover the mass. So that answers that. I hope that answers your question, the person that sent me that question. Thank you very much. So now let's now talk about breast cancer, really. It's been said that 1 in every 8 women develop breast cancer. And I looked in that, I was like, that is about 130 women per day. And that is in America. That's from American Cancer Association. So 130 women per day develop breast cancer. I said, that is huge. So it's very important for us to know about this. So my question is, so if about 130 women will develop breast cancer in a day, what are my risks of developing breast cancer? How do I know? What determines whether I get breast cancer or not?
Yeah, when talking about the risk factors for breast cancer, I like to divide it into two. We have the ones that are controllable, and then we have the uncontrollable factors. And the ones that are controllable, they are actually lifestyle choices that we can do without, that we can deal with. So the uncontrollable factors, the first one I'll talk about is age. You really cannot do anything about your age, and it is found out that breast cancer, the risk of breast cancer increases with age, especially in patients over 50. That 77% of women are diagnosed with breast cancer are over 50 years of age. So there's really nothing you can do about that. And then the second one of the uncontrollable factor is family history. That is, if you have a first degree relative that have breast cancer, like when I say first degree relative, what I mean is having a mother, having a sister, or having a daughter that have had previously developed breast cancer. That really increases your own risk of developing breast cancer. Then when you have a personal history of breast cancer, as you have had cancer in one breast, you have at least 3 or 4-fold of developing breast cancer in the other breast. Or you had a form of malignancy before, you have increased risk of developing breast cancer. The other one is race. We always say that, well, breast cancer is found to be commoner in Caucasians, but we find out that an African American or an African woman will die more from it than a Caucasian because of a lot of factors: late presentation, inability to have access to care. The list is a long list why an African woman will most likely die from the disease. And then another thing that you cannot control is your menstrual cycle and menopause. For people that have early menarche, that means people that started menstruating early, that means the breast started having hormonal insults early. And for people that have late menopause, as in around 50 or above 50 that are still menstruating, you find out that the breast still has a longer time of exposure to hormonal factors. So the other ones are things like maybe people that have a form of childhood cancers, they've had irradiation to the part of the chest, that will increase their risk, and they cannot really control it because it's something that happened to them earlier on. And then now takes into the other one, the controllable factors that you can actually modify. Number one is obesity. Obesity, especially onset of obesity after menopause, it has increased. You might have an increased risk of developing breast cancer if you're obese. And then diets that are high in fats or cholesterol or calories have been connected with increased incidence of breast cancer. Another thing is exercises, that when young women exercise, they end up decreasing their hormone level and therefore reducing their risk of developing breast cancer. So exercise plays an important role. If you exercise more, you reduce your risk. And the other one is breastfeeding. For women that breastfed their babies, that's been reported that there are lower incidences of breast cancer in such women. And then for people that don't have children at all, they have an increased incidence, increased risk of having breast cancer. And for people that start to have children late, all these things have to do with the hormonal interplay, that the hormonal exposure of the breast. And when we're talking of hormone, also long-term use of the hormone replacement therapy, that is estrogen and progesterone, in combination. When they are alone, they actually weak carcinogen, but in combination, they can significantly increase the possibility of having breast cancer. So also the oral contraceptives, which contains estrogen. This also places women in higher risk. Other things are alcohol intake, excessive alcohol intake. When you take about 2 to 5 drinks per day, this has been associated with increased risk of breast cancer. And also smoking. Smoking has also been seen to be one of the risk factors that can lead to breast cancer. So basically, those are the risk factors of developing breast cancer.
Thank you so very much. So what I'm hearing here is that we have some factors that we don't have power over. There is nothing we can do about it. You can choose your age, you cannot choose your race, you cannot choose. If you cannot choose it, then those ones are, there's nothing you can do about them. And then about those ones that are modifiable, I heard a lot about lifestyle. So if we work on our lifestyle modification, it decreases our risks to having breast cancer. So lifestyle modification, like the diet you take, exercising, quitting smoking, reduction of alcohol intake, and all that. Working on our lifestyle, modifying our lifestyle to healthy lifestyle, will help to reduce risk of breast cancer. I also heard her say a lot about hormonal interplay. When you started menstruation, or when the time at which you reach menopause, some medications that you take, hormone replacement therapy, or even oral contraceptive pill. Even though she said this had been said to play a very low impact, but an aggregate of it. So if you're taking it for a long time, then it might increase your risk for having breast cancer. Thank you very much. Now, how do we take care of our breast? What are the things that we can do to take care of our breast, to know if we'll be having these signs of breast cancer, and to know when to seek help?
Yeah, the signs of breast cancer really is a long list. And anytime you see any of these signs, it's always good to seek help. By mere looking at your breast, by mere inspecting your breast, do you notice any change in size? Do you notice any change in the shape of the breast? Is the breast swollen? Does it have a scaly skin, or the skin over your breast and the nipple area, is it red? Do you have puckering on the skin of the breast? Do you have this the things that you see on your breast, that you see a little bit that looks as if you're seeing hair follicles or something, what we call in our layman's, well, in medical terms, we call the pod orange. If you start seeing it on your breast, that looks like the peel of orange, you see this hole, as if there are hole on the breast, like in a layman's term. Then if there's discoloration, if there's dimpling, as in you're pressing your breast, it's going in, there's some form of dimpling. And then the other one is that, is there a lump? Do you feel a lump? And if you feel a lump, normally when breast cancer wants to start, the lump is always painless. Do you have a painless lump? So when you have a lump in the breast, you need to check, is there any area of abnormal thickening of the breast? And then you want to check the nipple, is there a discharge from the nipple? When there are discharges from the nipple, the one that is sinister is when there's bloody discharge, when there's some that are straw colored, or those ones that are brownish in color. Then you want to get closer to a healthcare provider to let them know all the signs that you have noticed on the breast. And in the bottom of that is pain. There's some form of breast cancer that can develop as pain, especially those ones that are the inflammatory types of breast cancer. You can develop pain. So in summary, what I've just said now is that when you have a lump in the breast, when you have change in size, change in shape of the breast, when you have discoloration of the breast, when you have scaly, the skin of the breast is scaly, is red, is swollen, when there's abnormal nipple discharge, bloody nipple discharge, or brownish colored nipple discharge, or a lump that you have noticed for some time that has now changed, that there's already change in size and change in shape of the lump, all these are signs of breast cancer.
Thank you very much. I mean, that's a very long list, but it's very important for us to know those things to look out for, so that you know when to seek help. I know most of us don't know. For you to be able to discover all those things, you have to know what your breast looks like. You have to know your breast. I wrote something on Facebook recently and I titled it, Know Your Girls. By girls, I mean breast. So you need to understand what is the norm for you so that when there is a discoloration, you know that this is not normal and then you'll be able to check it. It's been said that one in every 3 women do not check their breast. We don't want to look at our breasts. We shower every day. We just put on clothes because we see it as a taboo or as something that's not culturally acceptable for you to touch your breast or look at your breast or check your breast. But it's very, very important to know what your breast look like so that when you are having an issue, something that is deranging from the normal, you can decide to check it out. So on that note, I want to ask, how do we check our breast? How do we get to know that these are happening? What are the things that we can do to screen for breast issues?
Yes, screening for breast issue basically is like in 3 stages. Like there are 3 things that can be done, or 3 things are advocated. The first one is the self-breast exam. The second one is the clinical breast exam, and the third one is mammogram. Those are the screening tools that are being used. The self-breast exam is the one that you do yourself periodically, monthly, and it is advocated that you can start doing self-breast exam as from age 18. And you need to check your breast monthly, especially immediately after your periods. At this time, the regular lumpiness that is associated with the breast before, associated with your menstrual cycle, will have been reduced or not. It won't be there at that phase of the cycle. So the first 5 days of your cycle is advisable for you to check your breast and make sure that you do it regularly on those specific days. And what you basically check for is there a change in the skin color? You check, is there a change in the size? Is there a change in the shape? Is there any lump? Then that means you have to use your hand to now start pressing systematically from one end to the other, trying to feel any abnormal hardness or lump that might be in the breast. That's about the self-breast exam. The second one is the clinical breast exam, and this is the one that is done by a doctor, where you have to go for your periodic doctor's appointment to have your clinical breast exam done. And it is advocated that you can start doing your clinical breast exam from age 20. And from age 20, and between age 20 and age 40, you can be going for a clinical breast exam every 3 years. But as from age 40, you can be doing the clinical breast exam yearly in tandem with the regular mammograms. And then as from age 40, you can now do mammograms. And then in this part, we are still sticking to from age 40 to do yearly mammograms. In other climes, they've been advocating biennial every 2 years, depending on the age. But in this part of the world where I am, we are still advocating for the yearly mammograms. So those are just the 3 basic things that can be used to screen for breast cancer.
Good. Thank you very much. So I hear you saying 3, I can hear 3 age range right there, which I would like to talk more about. Dr. Feyi told us that from age 18, you should start doing self-breast examination. This is the one you do in your own closet by yourself. Clinicians had come up with a plan that you do that around monthly and around your monthly period. You start by doing it lying down. You lift up one head. If you're lifting up your left hand behind your head, you use the right hand to feel for lumps in a circular motion up and down. And then you repeat the same thing for the other hand. You also do another one by standing in front of mirror. That one, like she said, it will help you to check, is there a discoloration? Is there a change in size? Is there any dimple? Can I see any holes? Like she said, the pupil range. So you check for all those signs. You check them in front of the mirror. And then you check, putting your hands by your side, then lifting your hands up. That will help you to see exactly what the size of the breast is. It's also advocated that you also check your breast while in shower, that's standing up, and then you repeat the same thing like you did when you were lying down. So that's self-breast examination, and that starts at age 18. So we need to tell our girls, tell your children, tell your nieces and your family members that from age 18, they need to learn to do self-breast check for all these signs. And then she also mentioned age 20. From age 20, then you need to go to see the doctor and then get your self-check. The doctor will do clinical examination. That way, there are some things that we might have missed because it's us, that the clinician might be able to get. So from age 20, you continue to do that. And she said that is advisable to be done every year from then on. And then she also mentioned that at age 40, then you need to go for mammogram. Mammogram is the, let me say the x-ray of the check, is a radiograph of the breast to check what it's in your breast tissue, or whether you have lumps or what is going on in the breast. So you can, when you talk to your doctor about it, ask about what is going on in your own part of the world. Dr. Feyi just told us that in her own part where she's practicing, yearly mammogram is being advocated. So even if your own side of the world is advocating twice, mammogram every 2 years or every 3 years, I am sure that people that have risk for breast cancer will be advised to have yearly mammogram. So talk to your doctor about it. But the most important thing is that from age 40, you have to go for mammograms and get yourself checked out. So that's very important. So now that takes me to treatment option. There are some news that we don't want to hear. Sometimes we don't even want to go to see the doctors because we don't want to hear bad news. Sometimes you feel a lump and then it's like, oh, well, maybe it's not a lump, or maybe, well, it's just benign. But there are some news like it's cancerous, it's breast cancer. Nobody wants to hear that. So once we hear that, my question to you, Feyi, is what do we do from then on? If somebody has been diagnosed with breast cancer, what are the treatment options? What are the steps that such a person can take?
Okay, thank you very much, Seun. Before I even talk of the treatment options, please, I would like to talk about the genetic testing when it comes to breast cancer. It's been advocated that some genetic testing can be done, especially for the hereditary type of breast cancer. And in the type of breast cancer that you have, a family member having a first-degree family member, and the other people are predisposed or they have a high risk of having it. So that's what brought about the genetic testing. And basically what is done is that normally there's a mutation in the tumor suppressor gene of BRCA1 of breast cancer 1 and 2. And what happened is you need to check for them, the BRCA1 and the BRCA2 gene. And for people that are positive for this BRCA gene, they need to start their own screening for breast cancer earlier than the regular population, than the normal population, because they have a higher risk. Because being positive to that breast cancer gene can predispose you to having breast cancer, ovarian cancer, and even colon cancer. So even for them to have to be doing their colonoscopy, they might have to start before the regular time for the normal people. So that's why genetic testing is really being advocated now, so that you can prevent subsequent development of breast cancer. And really, it suffice to say here that it is not everyone that is positive that would develop breast cancer in their lifetime. Even if they are BRCA positive, they might not. But it is still important that you have that test done, and then you can be screening to make sure that you can detect whatever is going to happen early, and then you have prompt treatment, and the outcome will be better. And so, talking of the treatment options, what are the treatment options that we'll have? Treatment option depends really on, number one, your type of disease. Number two, it depends on the stage at which you are diagnosed. So there's no one blanket treatment for breast cancer. It depends on a lot of factors. As I said, on the type of breast cancer. Is it the one that is hormone receptor positive? That's those ones that are hormone receptor positive. That's why we need to study the biology of breast cancer. And that's one that will tell you the best method or the best approach at treatment. And then you want to do, as I said, the stage matters. You want to know the stage. And that means you have to do a lot of other tests. You want to check, is it still confined to the breast? Has it gone to the lymph nodes? Has it gone to other places that is further out of the breast? That is the staging. And that one will tell you what exactly needs to be done. And what are the treatment modalities available? We have the surgery, we have the chemotherapy, the hormonal therapy, and you have the radiation. And most times you need to do all for you to complete your breast cancer treatments. As I said, it is individualized, depends on your type of cancer.
Thank you very much. And I'm happy you brought in the issue of genetic testing. Like she said, genetic testing is very important. If you discover that you are at risk, that will help to determine if you have the breast cancer gene called BRCA1 and BRCA2. So those breast cancer gene can also, and she said, if you have the breast cancer gene, that's not like a diagnosis sentence. It's not saying that, okay, you have it and then you have breast cancer. It can also stand in for other cancers as well, like the colon cancer and the ovarian cancer. But if you're able to do that genetic testing and find out that you have these breast cancer genes, that will help you to start seeking help early. And when you start seeking help early, you can also check yourself for the other two cancers, colon and ovarian cancer, and be able to treat yourself. This will help with the prognosis of breast cancer at the end of the day. Thank you so much for that. And for treatment options, she mentioned there are different treatment options that you can go through. So when you go in to see your doctor, please make sure you discuss your treatment options with your doctor. She mentioned medication as one of the treatment options. And I know some people are always complaining about medication, the side effects of medication. So people don't want to take medication. So what are your views about that? What are the side effects of medication and how can people walk through this?
Yeah, as of any other medication for any other illness in the body, the medications, the drugs too for breast cancer can have a lot of side effects, really, really a lot of side effects. And for the chemotherapy, the side effects is endless, from alopecia to nausea and vomiting, to malaise, to weakness, to bone pain. There's a lot, but once you are in treatment, there are things that you'll be given that will alleviate most of these side effects, alleviate them, stop them, reduce them, depending on how bad or how severe your symptoms are. And then for example, for people that are on the hormonal therapy that have to take tamoxifen for like 5 years, that one too has its own side effects of increasing your chances of having blood clots, increases your chances of developing stroke, increasing your chances of developing endometrial hyperplasia. So all these things they know and they look out for. And drugs can be given to you targeted at reducing or preventing these side effects. But definitely there are side effects.
Thank you very much. So on this note, I want to ask you a personal question, Feyi. I understand that you as well, you're a warrior, like we will say, and a survivor of breast cancer, meaning you were diagnosed with breast cancer. Sometimes we feel doctors shouldn't go through this. Not even a doctor that is a radiologist work out with women to do mammogram and all that. So do you want to share, I know this is personal, if you don't mind, will you share some of your experience with your journey through the breast cancer? How did you discover your breast cancer and how were you able to walk through it?
Well, for me, really, that's true. I've gone through breast cancer treatment. I'm 3 years post-treatment. And then I will say that perchance I discovered my lump, despite the fact that I'm busty. I was able to discover the lump, which was about less than 2 cm. And there was from diagnosis, I had biopsy done within 24 hours of discovering this lump, and I had my histological diagnosis about 24 hours after the biopsy was done, and then it came out to be an invasive ductal carcinoma. So treatment was prompt too. I went through a time of neoadjuvant chemotherapy. I had a lumpectomy and I had radiation. And I'll tell you that in breast cancer treatment, apart from the physical treatment, apart from going to the hospital, the emotional treatment is very important. And then the support. And for me, I had a very good family support when I was going through my treatment. And that I have a lot of family support. I had support from my workplace. I had support from my friends. I was surrounded by people that loved me. So I went through it as if it was nothing. And I was positive from the first day of the diagnosis. Though difficult being a doctor, and you know 1001 thing that can go wrong. Because as I said, I was positive about it. I had the best people around me, my family, my siblings, my friends, my colleagues at work. So it made me really go through it with much ease than is expected. And 2 years post-treatment, and I'm still clear. And I
Good.
pray and believe I will continue to be clear.
Yes, amen. Amen. That's good to know. Wow. Thank you for sharing your life with us. I mean, you don't really have to do this, but hearing it from somebody that has gone through it, it's really, really helpful for a lot of us. And one important thing that I heard her say is that she was able to detect it early. And that is what we're trying to advocate here, for people to be aware of breast cancer, aware that there is breast cancer, and that it's very, very important for it to be detected early. She said her own lump was less than 2 cm, which is really, really early detection, and that helps with the prognosis. And she also said another thing that helped her is the support that she has, the family support, the support from co-workers and friends and families and all that. So that brings me to what I want to tell all our viewers today. You might not have breast cancer or you might not have breast issue, but that's your friend that has one, need your help. I mean, your help that is needed might just be, just listen, like I said, merely hearing that you are diagnosed with breast cancer can be so depressing. But if you have somebody that can listen to you, listen to what you have to say, that will be helpful to take a whole lot of burden off you. So be that person, that it's a good family support for somebody that is going through this. And so listen and then help the person walk through it. You don't have to give an opinion if you don't ask for, because sometimes we say things that get on the nerves of people that are passing through that particular issue. So also don't compare people. Don't say, hey, Dr. Daji that spoke went through our own like that. Why are you not? Because people are different, like she said, and it depends it depends on the stage at which it was discovered. It depends on your age. It depends on so many factors. So quit comparing that subject to another person. Each person is different, and the treatment and whatever they're going through is individualized. So be that person that respect the person's privacy. Don't just budge out, and then support. I mean, provide tangible help. Help like cook. I mean, it might go a long way to help cook for the person's family, do laundries, just be there and try to make the person feel the normal. Don't say, oh, breast cancer is not contagious, guys. It's not like if you if you go out visiting the person, then you have breast cancer. Make the person feel like I am still my normal self. So whatever the person used to do, as long as she has the strength to do them, be there to help them do it. Be there to help them, attend, some social functions that is allowable within their health. And that will go a long way to help. Thank you, Feyi, for sharing that with us. That is really, really helpful. And that brings me to my next question, which is, what will you say that is the forecast of the likely outcome of breast cancer? I know you are a survivor, but I've heard a lot of people that died of breast cancer. I have a close friend that died of breast cancer. My closest friend in medical school, the sister died of breast cancer, and that hit us a whole lot very, very hard. So we've had a lot of people die of breast cancer and a lot of people surviving breast cancer. So what is the forecast of the likely outcome? What is the prognosis of breast cancer?
Yeah, as you've said, prognosis actually depends on your type of disease, when it is discovered, the time, the stage at which the disease is discovered. For early detected cancer, the prognosis is really very good. But for cancers that are discovered late, the prognosis is bad. Because most time when you're discovering something that's like late stage 3 and in stage 4 disease, the prognosis is not as good as you have it with the people that are gotten even at stage 0, at the stage of carcinoma in situ. So, as I said, prognosis still depends on when, the stage of the disease. And that is the main reason why we've been advocating for early detection. That we have been advocating for breast cancer screening, for screening for breast cancer early enough, so that breast cancer can be detected earlier, that stage 0, and that you just take it out and as if nothing happened. So that's the basic thing that we need to do to improve prognosis. Really, people will still die for breast cancer, but we can make a difference. We can reduce the bad news that is associated with breast cancer if we do the needful in screening, in advocating for screening, in creating, in formulating protocols and things that will make people screen early, especially in our part of the world. In the Western world, there's already a program put in place. Everybody knows when and the time to screen. And even if you are forgotten, you have somebody to remind you that you have a mammogram that you need to do at so point, but we don't have that here. And that is why you still say that in this place, because they don't present early, they tend to die from it more when you compare to the Western world. So what are we trying to say? What we're trying to say is that, for example, in our national health insurance here in Nigeria, breast screening for mammograms is not covered. You only get mammogram if you want to rule out breast cancer. You want to diagnose a lump that has been found, or just the routine that, for every woman that is 40, let them have breast cancer screening. So if it's in our insurance, you can always call up everybody and send a letter to them and say, you know what, you had your mammograms at so time, you are due for it now. You can send reminders. Or in a place where to even feed is a problem, to call a woman out to do a breast mammogram for as much as 10,000 naira might be a problem. And then another thing that we are trying to advocate, that even when you are diagnosed, the enormous amount of resources that is needed to even treat breast cancer, that's what makes a lot of our patients around this part of the world default or seek help in other places, like the traditional people, like the religious houses, because of the amount of money that is involved in them getting care in the regular hospital. And then, for now, we're happy that I think our national insurance have incorporated cancer care into the national insurance scheme now, which we're happy about. But as I said, the treatment is still outside the reach of a common man. And it is not everybody that has a national insurance here where I practice. Basically, mostly those people that are working, those people with a white collar job. But the common market woman there does not have any health insurance. And so when it comes down with breast cancer, what will she do? For example, to get a full course of Herceptin, which is the one drug to treat breast cancer here, will cost about almost like 5.2 million naira for you to finish the course and just one part of the treatment. So all these things needs to be looked into for people to be able to have access to care. And then this is October. We have all forms of NGO. We have governors' wives, politicians, everybody going out, breast cancer awareness, Fine, it is good for us to have breast cancer awareness. In most of these programs, we detect women with breast cancer. What happens to those women? Who tells them where to go to? It is not just enough to be screening everybody. And then when you diagnose them, you leave them alone. Some of them don't even know how to go about it or where to start from. So what we're advocating, if we go out there to screen women for breast cancer, then we should be able to follow them up to make sure that they get the required treatment for their disease, and not just to screen them and just leave them alone. Because sometimes what you don't know does not kill you on time. But when you have screened them and you have told them they have breast cancer and they have no other place to go to, it is not good enough. So when we're advocating for screening, we are doing all this awareness in the month of October, we should go a step further to make sure they have access to care.
Wow. Thank you so very much. That is so really touching. I pray that your voice be heard where it matters on this. It's really, really touching to know. And thank you for the work you're doing. Thank you for advocating for breast cancer screening to be incorporated into the national health insurance. I am happy that that is being done now. But I hear you clearly saying that, I know to treat breast cancer treatment is very expensive. Even here in Western world, I know you talk about Western world. Even here in Western world, it's really, really very expensive. Most of the insurance that we have right there does not cover everything, or maybe does not even cover it at all. So it depends on how good your insurance is. And it's not everybody that have insurance. So I know the problem is more in the less developed country, but it also occurs in Western world as well. And I pray that those people in the position of leadership, those people that are topmost of policy making, we hear our voice today and try to do something about it. I hear you clearly talking about market women, and that pricked my heart, because if a market woman has to choose between eating and buy breast cancer treatment, they will choose to buy food. And that is the problem. We need to get to a point whereby we're not making our citizens choose between to eat, to live, or to not take medication to live. So I pray, like you said, there are a lot of NGOs and all that in Nigeria and other parts of the country. I believe what the NGOs should be looking at right now is how to help the hospitals and the doctors. Let's all work together and find a solution, find a way to help people. I heard you clearly. You said that what you don't know does not kill you. So sometimes if you don't even know that you have breast cancer, you just go about your life. But now we've passed through, we've been able to win over adding breast cancer screening into our national health insurance. So what happens after they're screened and diagnosed to have breast cancer? What happens when you tell a market woman to bring 5.2 million? I heard you say that's a lot of money. I believe that's even a lot of money for people working in Nigeria right now. Bring 5.2 million for medication. Wow. Seriously, wow.
Yes, that's the reality.
Seriously, wow. And I mean that I can feel how frustrating this will be for medical practitioners that are attending to these people. You know,
Yeah, definitely as a doctor, you feel so bad when you're treating a patient that cannot even have access to the drug.
oh my God.
I have various examples. I have patients that practically, I would tell you that I try to raise funds to make sure that they have these drugs. At some point, every month, it's not even every month because some is 2 weekly. When a dose of acetylene will be costing between 285 to 325,000 naira per dose. And for a patient that would take like 17 doses to 19 doses, and every 2 weeks. So it's enormous. So rather I'm saying that you can, my plea had been for these people that cannot afford it. Even I'm talking to you as a doctor, I don't think I can afford it. So the idea is that we need to do something and to make sure there's a program that these drugs can be provided, even if it can even be subsidized. It's not now saying, oh, let everything be free. No, but so that we can have a subsidized form of these drugs. But I can tell you, people are out there suffering. The suffering is enormous. You have to be close to them for you to know what they are passing through. To treat any form of cancer is not cheap. Not just breast cancer, any form of cancer.
Any form.
Is not cheap. And then even to have access to cancer care in Nigeria, for example, is a little bit difficult. And as I said, government, NGOs, individual people with that have the means, instead of spending all the money to sponsor football, to sponsor all these things, I think we should look inward into health and try to alleviate people's suffering.
Wow, thank you so much. I hear you clearly. And I feel you. So
yeah, thank you so much.
Yeah, that's so overwhelming, I tell you. I didn't know this would go this way today. I wasn't expecting that, even though, I mean, it's something that I know, but hearing it from you right now is just so overwhelming for me. I'm actually trying not to cry right now. It's really, really overwhelming. So what Feye is trying to tell us, I hope some of our leaders will hear this, is that we should put our priorities right. Let's place our priorities right. Let's prioritize the lives of our citizens over things that don't matter that we do, over building thousands and thousands of houses or hiding money somewhere. Let's prioritize the lives of our citizens. Let us pour more money in the healthcare system. Let us help people that don't have means, people that don't even have insurance. Let us help them. She's even saying subsidizing the medications. You guys subsidize the price. I mean, we know it's going to be a huge cost. If we're saying you should give it for free, that's not what we're asking for. Let's subsidize and make it available for people. I mean, this is why most of our citizens are resolving to sitting in churches or going to traditional help, putting palm oil on the breast rather than going to take medication from the hospital or doing surgery, because they cannot afford it. I mean, it's good to use whatever belief you have. I heard Feyi saying when she was telling us about her own personal experience, she said that I've been free for 2 years and I believe God will keep me. So it's good, believe God. This program is a Christian-based program, so we're also pushing out believing God, pray about it, but it is very important for you to seek medical help. If you're diagnosed with breast cancer, as you're praying about it, you should also be seeking medical help. Then we are saying that, but how are we helping you to seek medical help when you cannot afford one? So I pray that something will be done. Thank you for what you're doing, Feyi. Thank you for all the
much.
Yeah, and I believe that your voice will continue to be heard, and people that matters, individuals that have the means, NGOs should do more than just raising awareness, and then the government should step up and do something about it. Thank you so much.
Thank you for having me, Seun.
Thank you. So said all this, I believe that we've all been able to gain one or two things from today's discussion on breast cancer. We've been talking with Dr. Feyisayo Daji since she's an advocate of breast cancer, and she's been very, very awesome. Thank you for coming. So as
Thank you for having me.
a parting, do you have a parting word for us?
Well, what I just want to say is we should do our screening to detect breast cancer early enough. And then to those people that are battling this disease out there, I just want to let them know that they should keep hope alive, that they will be going, by the grace of God, they are going to be okay, and that they should be positive and just know that it is one of the passing phases, and that this time of breast cancer for the treatment and everything will pass, and that they are going to come out stronger than they started. Thank you very much.
Thank you so much. So keep hope alive, be positive, and this time will pass. So that is the parting word that we're getting from Dr. Feyi this afternoon or this evening, depending on wherever you're watching from. Thank you so much for joining us. I hope I was able to answer all the questions that were sent to me. If I'm unable to answer your questions, you can send me another inbox and I will, send the answers to you. Thank you so much for joining. And thank you, Feyi, for coming. Thank you for out of your busy schedule. I will say again, thank you for making it here today. And then this, like I said, is 12 o'clock. This is a vision that has been set up to help us prosper in all our ways. To thrive means to be prosperous in whatever you're doing. So in this life, we have to do more than surviving. Most of us are just surviving, we're just living. If you have breath in your life, it is time for you to thrive. It is time for you to prosper, and to prosper in health, and to prosper in everything you do. So thank you again for joining us. Till next time, I'm leaving with you with this. Continue to boom, to bloom, and to blossom. Thank you. God bless.